Matthew, thank you very much, and I want to thank you for all of the work you've done behind the scenes and the rest of the staff in making this happen. We're all excited here at Orlando Plastic Surgery Center to have our first webinar, and I want to thank all the participants. We have quite a number of people from as far north as Canada and as far west as Texas, and we have quite a number of people from right here in Central Florida as well. So I want to thank you all for joining us. What I'd like to do in the next hour is talk to you about obviously gynecomastia, but talk about some of the causes, some of the symptoms that people who suffer from this may have, and then we'll get into non-surgical treatment. But I think most people who are attending here are interested in the surgical treatment, so I want to make sure that we spend a good bit of time on that. As far as definitions go, and I have a feeling that most people who are involved in the webinar tonight are either have gynecomastia or maybe have a loved one or a family member who does have that. So most people realize that it is a condition where a man has a typical breast enlargement that can involve one or both breasts. Now, it can be asymmetrical. Some men can have, I think the majority really have this affecting both sides, but a number of men have this affecting just one breast and not the other. And this is a picture of one of my patients who had repair on just the one side, and we'll show you that a little bit later. As far as causes are concerned, gynecomastia is caused by an imbalance between testosterone and male estrogen. As you may know, men have a certain level of estrogen. Women certainly have much more, but men have estrogen as well. And when there is an imbalance, that's what can lead to the development of breast tissue. There can be different factors that can cause this. They can be internal factors or external factors. I'll get into that. You can see in the schematic that the breast tissue can be very large, and it can be excessive in a number of people. Some people have just a minor case where they just have breast tissue lying right behind the nipple-areola complex, but many other people, and I'll show you some examples later, can have pretty significant growth, and I'll get into the causes of that. As I said, some are internal factors, some are external. We can talk about the internal factors first. There are a number of medical conditions that can lead to development of breast tissue in men. One that is fairly well known is Klinefelter syndrome, which is actually a genetic disorder where a man has an X and a Y chromosome, which is normal, but has an extra X chromosome. That can lead to some other issues, but obviously gynecomastia is one that certainly comes into play with many people who have Klinefelter syndrome. Aging I have listed as an internal factor. That's something that no one can really prevent, of course, but you see this as men get older and the testosterone level drops. I think testosterone level peaks during your 20s, and as it starts to wane over time, you can get increase in body weight, which unfortunately most of us see as we get older, but that can translate into excess fat on the chest wall and actually in some cases excess breast tissue. There are tumors that can cause gynecomastia in men, as well as situations with the thyroid gland. If you have hyperthyroidism, that could lead to it as well. Certain other organ systems can fail and can lead to problems with gynecomastia. Kidney failure patients have a higher risk of that, as well as men who suffer from liver failure and or cirrhosis of the liver. Regarding external factors, malnutrition plays a role, and that is basically because of an abnormal testosterone level. The testosterone level is low in situations like this, but typically estrogen levels do remain the same. And with that relative imbalance, you can develop gynecomastia. And then other external factors include drugs, both therapeutic drugs and illicit drugs or illegal drugs. And then, of course, alcohol can play a role. Regarding therapeutic drugs, there is a laundry list of drugs that can lead to that. And one of the drugs that I think is the most widely known is an anti-androgen drug, Propecia. It's used for men who want to regrow hair or prevent further hair loss. In larger doses, it's called Proscar, which is a drug that actually is used to help prevent or treat prostatic hyperplasia or enlargement of the prostate gland. So a number of men who take Proscar therapeutically can develop gynecomastia and need to be aware of that and aware that that's a risk. Several other drugs can cause that, and they're listed here. Many of these are cardiovascular type drugs. Some antibiotics can also play a role. Also, HIV drugs can cause gynecomastia, as well as Valium. Digoxin's another cardiac drug, amphetamines, and then there are a number of anti-ulcer drugs, and unfortunately those can all lead to gynecomastia development as well. Now, in talking about illicit drugs, I think this is where pretty much everybody's aware. You know, everybody hears about the guy who is the guy in the gym who is on anabolic steroids, and they certainly can play a role. And I've had a number of patients who admit to maybe just one course of steroid use, and that was enough to cause a pretty significant gynecomastia that was irreversible without surgery. Marijuana can also lead to gynecomastia, as can heroin. Okay, regarding symptoms, we'll talk for a few minutes about that. They're pretty obvious. The obvious symptom is chest wall abnormal shape. A man basically develops excess breast tissue, which causes an abnormal appearance or female appearance of the chest. Now, asymmetry is also an issue. As I said earlier, this can happen in many cases where only one breast is involved, but by far the majority of cases involve both breasts. Men can also develop tenderness or even pain in one or both breasts with gynecomastia. But I think the biggest issue that I have patients talk about is a psychological or social problem that they have from basically having appearance of breast on their chest wall. It really impairs self-confidence. Many men in my practice that come in here as patients talk about how they avoid all types of activities because they're too embarrassed to go out without their shirt on. I have men that talk about never wanted to go to a beach party. Many men have even told me they don't go swimming with their children. Avoidance of intimacy is another issue. A lot of men talk about wearing shirts when they're with their significant other in bed, so it's a big issue. As far as risk factors go, I did want to throw this out there, not to alarm people, but just to make you aware that of this fact that men with gynecomastia have a 5 times greater risk of developing breast cancer than men without it. Now, that doesn't mean if you have gynecomastia, you're really at a high risk. It's just because you have the gynecomastia. It's related more to the imbalance in hormone levels, and it's just something that you need to be aware of. And many times we'll talk about the need to submit tissue to pathology to be tested. I'll talk a little